A growing number of candidates will have some more time to make their case for mayor in this year's regular city election, but that also includes addressing concerns that require immediate response, from access to vaccines and recovery for the Boston Public Schools. To tell us what that should mean is one of the two candidates who announced their campaigns for mayor last year, City Councilor at Large, Michelle Wu. Thank you very much for being with us, Councilor.
Thank you for having me.
Councilor, I know it sounds dangerously close to a campaign promise, vaccines in every zip code, but get a little more granular. What should that mean about making this work?
This is the most immediate, most urgent step we could be taking right now to end the pandemic. And in fact, we are up against the clock. The vaccines provide protection for individuals, but also for the larger community. And so as we see that variants of the COVID-19 virus are already popping up, we want to make sure that we're getting everyone vaccinated and, again, ending the pandemic before another version of the virus mutates that will be resistant to this, or that will cause us to go on longer. And so we need to be building trust for the vaccine in all of our communities. That requires running a transparent, effective process of registration and sign up and delivery. And then also actually making it possible for people to get to the appointments that they have signed up for and that they're able to access once they decide to get the vaccine. We can't have only singular sites where everybody has to travel on mass transit or expose themselves to risk in getting there. We should be really removing the barriers to accessing this life-saving protection for every community. And that means all throughout the city of Boston.
It seems the big spaces, like even the Reggie Lewis Center, are low-hanging fruit. But what about the other kinds of barriers, that the people who don't have internet, the people who can't seem to get through on a phone? What about them?
Yeah, it's been incredibly frustrating to watch the rollout of this process. We are just down the road from where this vaccine was created, that the entire world is relying on. And yet we are far, far behind in the bottom half of states in the United States for how effectively we've been distributing this vaccine. Whenever there's a process that first opens up with first come, first serve and online signups, we know that this will perpetuate inequities. And so residents who were not able to wait online with multiple tabs open, trying to book this and that appointment before it got snatched up, it just means that we are not serving our most impacted communities in a priority way. And we should have been taking registrations to then book people into slots based on zip code, age, health factors, and other issues, so that we are distributing this vaccine, which is still a very limited resource at this point, as the federal government is working to roll it out, but to do it in a way that gets us closer and faster to serving the communities that are most impacted by this virus.
What about reaching out to the population that needs this? Working with community organizations, doing it in multiple languages.
That's right. We know that there are many barriers that COVID-19 has deepened, and the access in terms of the history of medical disenfranchisement of Black and Brown communities, language barriers, the ability to show up at a certain time of day that it doesn't fit with traditional work hours. All of these barriers need to be tackled, and we need to be thinking of this as a proactive, almost person by person, door to door approach. Think about how we were addressing the census and needing to ensure that communities who are often undercounted were prioritized and centered despite tremendous challenges from the federal government. This is the same situation now with the vaccine. As we're waiting for the supply of doses to expand, we have to be building trust and getting out into communities, ideally utilizing every single piece of public infrastructure we have, community health centers, first responders, our public buildings, to make sure that there are safe ways to even be taking the vaccine to residents who may find it dangerous or difficult to be leaving their homes to travel to these sites.
I'm going to bridge the topic of schools, but by way of teachers and their access to vaccines, should that be bumped up?
Absolutely. We have teachers who, for their livelihoods, have no choice but to be in spaces that are indoors, sometimes without top-notch ventilation, with large groups of people. And so we should see the prioritization, the access immediately available for teachers, particularly for our educators who are already back in in-person learning situations. we have seen in this pandemic, our schools are critical infrastructure that go way beyond just where we send our young people to learn about math and science and language every day. These are food security hubs. It is a place for social emotional supports. It is critical to our economy that working parents and guardians have a safe place for children and young people during the day. So the faster that we can support our teachers and our school communities in being fully reopened and fully safe up and running, the faster our economy and the entire community will be protected.
What about school recovery? I know some of this is about money for equipment and maybe remediations of some kind, but if you look at Cambridge, there is a program for students who should have been at high risk, who should have fallen even farther behind, and they're getting good results. Why don't we see more of that in Boston?
Yeah, that's right. We need more than just a new policy approach to Boston Public Schools. We need to rethink how we are serving the whole child and the whole community. And so this is really the moment to recognize just how much our schools are the hubs for the entirety of what goes on in a family's life. So I would propose that we move towards a system where we have a youth cabinet, where we are seeing young people centered with Boston Public Schools side by side with the Office of Housing Stability, Department of Innovation and Technology to address the digital divide, the Office of Immigrant Advancement. All the resources that we have on the city side should be holistically directed to lifting up and supporting our young people and their families. Our schools are our top priority. And I'm now on my second round of being a Boston Public Schools mom with two boys who are 6 and 3, who have been learning outside outside my home office with fits and starts of the remote learning. Teachers doing a great job, but incredibly different and challenging for young people on computers. And I also had raised my sister through middle school and high school in the Boston Public Schools. So we need to close gaps, and we need to do so in a way that recognizes how to serve whole children and whole families.
Digital access has been part of the problem with education. Do you have an idea for bridging the divide? It includes the possibility of the city sort of stepping in and being its own provider. That could be more expensive. Is it necessary to go far, at least that far in that direction?
Boston is lucky to be a city where we have 5 different internet service providers serving our communities, in comparison to, for example, some rural communities where it's difficult to find a provider to see that as an economic opportunity for them. We have multiple providers, but it's often a patchwork. So we know there are still buildings in the city with dial-up access only. We know there are 15% of households in Boston without a home internet subscription. 8% of households access internet through Wi-Fi data plans on their cellular phones, and that number is up to 30% in some neighborhoods. And so we need to ensure that we are guaranteeing access to high quality, reliable internet as critical infrastructure for every community, closing those gaps, but that there's also the hardware and the skills for every family to be able to access this connection. If we can get to the point where we are working with all of our providers and the companies offering these services in Boston, Comcast, RCN, et cetera, great. We would love to do so without the expansion of the resources of city services. But ultimately, this is a public good, access to critical infrastructure. And if we can't get it together that way, then the city should step up and move towards providing its own public option.
Another gap you're concerned about is in city contracts for services or procurement of materials. I think we already heard about this gap before. There's a new study showing, simply confirming this. People of color who had companies are getting a very, very small share of this. What can be done? I mean, we've seen other cities take this on and maybe do it differently. What should be done in Boston?
Yeah, this is an issue that I have been fighting for and championing for years at this point. It was after a 2017 ordinance that then Councilor Ayanna Pressley and I wrote and passed that we got the first reports of just what the numbers were on city spending. And in 2018, that was 0.65% of our public contracts, $664 million worth of contracts, less than 1% going to businesses owned by people of color. in a city as diverse as Boston. And today's or the disparity study that has now been out is the result of our pushing to push for an actual analysis and movement and action on how to close those gaps. There are many things that we could have been doing all along the way, making it fully transparent, making it fully accessible, and putting some funding to outreach to ensure that we are tapping into the talent and the entrepreneurship in the city. The key about the disparity study that came out is that it's not just the 1.2% number, that out of all of these years of public contracts, still 1.2% to Black and Latinx owned businesses. It's actually, there's a critical figure of 16.9%, which is the capacity that we have out in the community from businesses of color right here in Boston. And so that is the baseline for what we should be hitting. Is we often hear excuses of, well, the city would like to be ramping up our contracting and closing the racial wealth gap, but the demand and the partnership and the entrepreneurship simply isn't there in the community. This disparity study disproves that. We should be at a minimum of mid to high double digits. And in fact, most other major cities are well into 20%, 30% contracting numbers in terms of businesses doing business with businesses owned by people of color. This should be a new floor for us, not a ceiling, and we have a lot more work to do.
Does this have anything to do with the way contracts are structured that somehow excludes companies?
Absolutely. We are a city that has a lot of inertia on this topic. It's often multi-year contracts that come up every 3 years or so. And so while there is transparency, you could log on right this second to the city's portal and bid for any of the available contracts today. It doesn't tell you when the next contract on this or that goods or services comes up. And so without a transparent buying plan that lays out how companies should be preparing for what levels of supply to be able to bid on city business, our business owners are left checking the website every day or trying to figure out how to break into the system. We also should be unbundling some contracts instead of doing all of the windows over in the Boston Public Schools through one contract that only a very, very large company could take on. We could bundle it by region and make sure that we are having smaller contract sizes so that our local businesses can get a foot in the door, work through the public contract, and then grow their business, keep jobs locally. There is such a return on investment when we are building wealth right here in the city of Boston.
Well, thank you very much for taking the time to go through all of those topics with us.
Thank you for having me.
Boston City Councilor at Large and candidate for Mayor of Boston, Michelle Wu. Thank you very much.